questi sono i canti che hai ascoltato già, desideri che attraverso i secoli.
Assalamu alaikum and good evening, dear viewers. Welcome to a brand new episode of Harmony of Life. I'm Saleh, along with my colleague Camille Janvier. Camille, good evening.
Good evening, Waleed. And good evening to the viewers and welcome. Assalamu alaikum. Thank you for joining us this evening for another episode of Harmony of Life. And this evening we have some great topics lined up for you. For our first topic, we are going to be discussing maternity and the growing fetus. With us to discuss this, we have Dr. Abdullah.
And later on in the program, we are going to be talking about olive oil and green tea, the benefits of both, with Dr. Muhammad Al-Tufail.
And before this, we are going to be looking at the tweets we've been receiving today, and we're going to be talking about first impressions. So let's look at the tweets that you've been sending us.
And those were the tweets that we gathered from Twitter on the topic of first impressions. Now it takes just a quick glance, maybe 3 seconds, for someone to evaluate you when you meet for the first time. In this short time, the other person forms an opinion about you based on your appearance, your body language, your demeanor, your mannerisms, and how you're dressed. With every new encounter, you are evaluated and another person's impression of you is formed. These first impressions can be nearly impossible to reverse or undo. Making those first encounters are extremely important, for they set the tone for all the relationships that follow. So whether they are in your career or social life, it's important to know how to create a good first impression.
Definitely true.
I was leaning on like I had more to say, but that's all
I definitely think that's true. Well, in psychology, a first impression is the event when one person first encounters another person and forms a mental image of that person. It can sometimes form an accurate representation of the person depending on the observer and the person being observed. First impressions are lasting impressions, and although sometimes misleading, research shows that in many situations, our impressions of other people can be quite accurate. Only in more serious situations is going beyond first impressions to seek greater accuracy in person perception sometimes important. It takes just 1/10 of a second for us to judge someone and make our first impression with confidence in impression formation, increasing with increasing time taken to form the impression.
Of course.
So what do you believe in first impressions?
I do believe in first impressions, but I always don't know what first impression to try to push on people, what to make people think of me when they first meet me. Sometimes I think that no, I should try to be more relaxed, more at ease, so that they can get the feel that I'm approachable, that I'm laid back, that I'm nice. But on the other hand, sometimes you don't want to do that. You want to give the impression that you know, you're one who should be, you know, just not to be taken lightly or so on. So sometimes I kind of mess it up in terms of giving off a first impression. And in the end, I tend to give off an impression that I'm just an arrogant or just...
Overconfident.
Yeah,
or
probably,
something.
yeah, which I'm not at all.
Yeah.
But apparently that's the first impression that many people say I give off, that I don't know.
But I think really you just have to be yourself and try to be relaxed, of course. Try and just be yourself no matter what. And, you know, whoever you are, that's how you're going to come off.
True.
Or you should be. But again, I do believe that first impressions are very important, but I do also think that you shouldn't just judge someone on a first impression, because that's not always...
And I don't really believe that...
yeah.
that first impressions cannot be undone.
Exactly.
They can't be undone. Or otherwise I wouldn't have any friends right now.
Exactly.
Every single person who knows me now and who knows who I am, they say that we had a very terrible first impression about you. So that just goes to show that first impressions can be undone.
Exactly. I mean, I've met people before now, and I've thought not very highly of them. I've thought they were arrogant or different things, and not very nice people. And then come to meet them, come to know them, and realize that actually they're really, really quite nice people. So I don't think you should just prejudge someone, like judge the book by the cover kind of thing.
Yeah. I hope I didn't give you a first impression.
No, I've always actually thought you were really nice.
Okay,
yeah,
good.
Yeah.
Good.
So don't just judge someone on a first impression. That's what I would say.
Exactly, indeed.
Definitely.
But now let's move on to our first topic of our episode, which is about healthy pregnancy leading to a healthy baby with Dr. Samir Abdullah. We're going to go with a report, and we'll be right back to start our show. Stay tuned.
Nutrition is vital during pregnancy. Your baby needs plenty of vitamins and minerals to develop properly, and you need them to stay strong. As you probably know by now, pregnancy is exhausting. Ensure your baby gets the food it needs. Most pregnant women need to eat only 300 extra calories a day. That's a healthy weight gain of about 5 pounds during the first trimester. While you're pregnant, try to eat 3 daily servings of protein to support the baby's rapid growth. Consider lean meats, eggs, and legumes. Calcium also helps babies build bones. If you're not fond of milk, consider kale or edamame. Bold, colorful fruits and veggies contain the most nutrients to help your baby grow. Apples and iceberg lettuce are good for you, but mangoes and romaine lettuce are even better. Of course, you'll need certain extras too. Your pregnant body can't store essential vitamin C. Get a fresh supply every day with strawberries, melon, tomatoes, and of course, orange juice. Mineral-rich whole grain breads, cereals, and pastas provide vital nutrients and can also combat pregnancy-induced nausea. To prevent anemia while pregnant, you'll need more iron. Spinach, soy products, dried fruit, and blackstrap molasses are all great choices. To stay hydrated and healthy, aim for at least 8 8-ounce cups of fluid daily. Water is best, but milk, sugar-free juice, and other liquids count too. Fill in any gaps in your diet with a multivitamin formulated especially for pregnant women. While pregnant, you must remember that not every food is healthy for you and your baby. Alcohol is a no-no. Even moderate drinking can induce complications. Caffeine is okay in small doses, but stay below 300 milligrams or 3 cups daily. That's because caffeine can counteract the benefits of calcium and may increase the chances of miscarriage. Minimal unsaturated fats and salts are fine, but limit total fats to less than 30% of your daily calories. Also, avoid empty calories like those found in processed and junk foods. You may love sushi, but pregnancy isn't the time to eat anything raw or undercooked. Cook meats until well done and fish until it flakes. Make sure egg yolks are cooked through and that all dairy products are pasteurized. Steer clear of herbal supplements and teas. They're natural, sure, but ginkgo biloba and St. John's wort can have negative effects on a pregnant body. And some supplements are downright dangerous. Juniper and raspberry leaf tea, for example, both increase the risk of miscarriage. Of course, if you're pregnant, discuss any medications you are taking with your doctor. Many other natural therapies like massage, meditation, and acupuncture can relieve stress and ease the physical aches of pregnancy. Just be sure to tell any practitioner that you are pregnant before beginning a session. The bottom line is that natural is better when you're pregnant. Always consult your doctor before trying a new diet or therapy.
Welcome back, everyone. And that was our first report, and it's about our first topic this evening, which is concerning pregnancy and fetus. And now with us to discuss maternity is our Dr. Dusmir Abdullah, who's a consultant of obstetrics and gynecology and maternal fetal medicine, and from the Canadian Fellowship in Maternal Fetal Medicine, a director of maternal and fetal care from the unit of the Turia Medical Centre. Welcome, Dr. Abdullah. Thank you for joining us this evening.
Thank you. Good evening.
Good evening to you. Dr. Abdullah, first of all, if you could tell us a little bit about the importance of maternity care.
Sure.
Yeah.
First, I will introduce the terminology of maternal fetal medicine, because I think some of the viewers, they are not aware of this subspecialty. So the maternal fetal medicine is a branch of obstetric, which deals and focus on the fetal care and the medical and surgical management of high-risk pregnancy. So maternal fetal medicine specialist is an obstetrician who has undergone a specialized training for an additional 2 to 3 years in the evaluation and the management of high-risk pregnancy. So after those 2 years of training or 3 years of training, they would be able to counsel mother mothers who have underlying medical disorder like diabetes, hypertension, kidney disease, heart disease, clotting problems, or other medical conditions. Also, they are able to take care of the pregnancy-related complication like preeclampsia, which is high blood pressure during pregnancy, also preterm labor, or also mother who carries fetuses at increased risk of birth defects or congenital heart disease or genetic disorders or chromosomal abnormalities or growth restrictions. So basically it's an additional training for 2 to 3 years. So the specialist will be able to estimate the risk on the mother or the fetus, trying to prevent or minimize those risks and optimizing the outcome for the pregnancy.
So that is your specialty, doctor?
This is my specialty, yes.
I see. Okay.
Well, Dr. Abdullah, in terms of your practice now,
yes,
how is the examination of the fetus done during pregnancy?
So basically, there is a simple test should be offered to any pregnant ladies, whether she is at high risk or low risk. We define them as low risk or high risk. So the test which we offer to any pregnant ladies during pregnancy, which we can examine the fetus by those tools, is ultrasound. And we call ultrasound non-invasive testing because it doesn't carry any risk to the fetus or the mother. Basically, there is two important ultrasound we should offer to any pregnant ladies. One in the first trimester, between the 11 and the 14 weeks, which we call nuchal translucency. Nuchal translucency is a test which screen the fetus for the risk of chromosomal abnormalities like Down syndrome or other malformation like congenital heart disease or other fetal syndrome or other congenital heart disease, congenital malformation. Basically, we perform this test between 11 and 14 weeks. We measure the length of the fetus at that time, what we call crown run length, which correlate to the gestational age of the fetus. And then we test, of course, fetal viability. We test the fetal heart motion of the fetus, fluid around the fetus, and then the nuchal translucency, which is the specific test which measures fluid underneath the skin of the neck. And basically, as the risk, there is normogram, which like normal values for this measurement, above which the risk will increase for chromosomal abnormalities or for congenital heart disease or for other malformation. The second test by ultrasound, usually we perform between 18 and 22 weeks. And this is very direct test where we specifically examine all the organs of the fetus, like the brain, the heart, the kidneys, limbs, stomach, and so on. So this is what we call anatomical scans or structural anomaly scan, where we examine the structure of the fetus, making sure that everything is formed like in the normal, as it should be.
And when examining, is there, for any abnormalities that you find in the fetus,
yes,
are there any conditions that can be corrected before birth?
Yes.
Or
basically, if we perform, like for instance, the first trimester screening, and we found this nuchal translucency is very high, then we counsel the mother about the increased risk of Downs and other like congenital heart disease. So we go to the next step of advanced testing, which is we call it invasive testing. Invasive testing because it has a carrier risk on the pregnancy of miscarriage if we are doing it. So the type of test which we call invasive testing, first is what we call chorionic villus sampling, like sampling the placenta between 11 to 14 weeks. When we sample the placenta represents the fetus. So it represents the genetic background of the fetus. So if the fetus has increased risk of Down, if we took the sample from the placenta and we send it to the lab, we can tell this is a fetus with Down syndrome, it's a normal chromosome. The same thing applied for families who carries genetic problems, where the mutation is known, like metabolic disorders or so on. We can test the fetus at this gestational age, and we can tell the mother whether this fetus is affected with the genetic disorder or not. So those are diagnostic testing, after which certain condition which is lethal and so on, we can offer interruption of pregnancy before 19 weeks of gestation. Other conditions which we can also diagnose by the second trimester screening, by ultrasound, some of the condition we can treat, like if the fetal heart is too fast, there's certain medication we can give to the mother which can slow down the fetal heart and it can come back to normal. Other condition is we cannot correct it during pregnancy, but we can optimize the outcome by timing the delivery and choosing the best place, like an institution where they can do the intervention. They can do the intervention immediately, like congenital heart disease, some condition, we have to do something immediately within hours after birth. So the team is ready, and the intervention can be done in a short time, where can have the best outcome for the fetus.
Dr. Samir, you're describing, first of all, that the mothers who, for instance, the high-risk pregnancies, women with preeclampsia and other high-risk women with other high-risk potential pregnancies who come to you, first of all, do they get, are they in their normal consultants? Do they then get told to come to you? Do they get advised to come to you?
So basically those patients, either they come to us in the first place for counseling, or they are seen by their obstetrician, and then if they have like a high-risk condition, whether on the mother or on the fetus, they get referred to us, and then we can counsel the couple. Yes. So either they come directly to us because they have previous history of an affected baby with the genetic problems, or she is known to have a medical disorder like kidney disease, diabetes, so they come directly to us, or they go to their general obstetrician, where he would identify a high-risk situation where they would refer the patient to us for counseling. Yes.
I see. And then you would then go further.
Well, then we go further according to the case itself.
I see. Okay, well, we're going to go for a report now, and then we'll be right back and talk some more about this. So stay tuned, we'll go for a report.
How to get pregnant with twins. Motherhood is hard enough without adding twins into the mix. But if you're interested in finding out how to get pregnant with twins, some factors may help. Bear in mind, however, that conception is largely an uncertain proposition, with a lot of possibilities beyond human control. Even doctors trained and experienced in IVF, in vitro fertilization, cannot guarantee a 100% success rate. The odds are slimmer for conceiving twins. there is no surefire way to have twins at will. The following factors are said to increase the chances of having twins. They are gleaned from years of study and observation of common traits among mothers of twins. 1. Genes. If you're female and your family has a history of having twins, then you are more likely to have twins yourself. This is because the capacity to produce 2 eggs at once, hyperovulation, likely runs in families. Having a partner who is a twin himself may increase your chances if twins run in his family, but not by much, as he can't pass the hyperovulation gene to you. If both partners have a family history of twins, then that should make the odds even better. 2. Science helps. You can consult a fertility doctor to help improve your chances of multiple conceptions. There are medications and medical interventions that sometimes result in multiple fertilizations at a time. This is why some IVF and medically aided conceptions more often result in multiple births than natural conception. A disclaimer: if you went to a fertility doctor for help conceiving twins, but were perfectly able to conceive without such aid, you wouldn't be likely to be accommodated. Ethical practice doesn't allow it. And if a doctor is unethical enough to promise to help you to conceive twins under these circumstances, you really shouldn't entrust your health and that of your baby to him. 3. Getting pregnant right after going off birth control pills may also help. While the woman is taking pills, her body gets used to the artificially regulated hormonal functions. After she goes off the pill, her body has to adjust back to self-regulation, and this may enable the ovaries to release 2 eggs at the same time. If both get fertilized at once, you've got twins. 5. Plump up. Women with a body mass index of 30 or more have a greater chance of having twins. This may be nature's way of ensuring that the mother can nurture and care for 2 babies at a time. After all, having 2 babies dependent on one source of nourishment while in the womb could be a huge drain on the mother's reserves. 6. Increase your daily dairy intake. Some studies say that women who have a higher intake of dairy products and dairy-based foods are 5 times more likely to have twins than those who don't. The connection between dairy and conception is not clear, except perhaps for the possible effect on the human body of milk from cows that have ingested growth hormones.
And that was a report on twin pregnancies. With us in the studio still, Dr. Dسمير Abdullah, the consultant of obstetrics and gynecology and maternal fetal medicine. Now, Dr. Abdullah, looking at that report just now, talking about twin pregnancy, how do you console a couple who's trying to get pregnant and very much desire twins?
Okay. Recently we had it's a bit trendy. Lots of patients, they come and they like the idea of having a twin. Usually we discourage those couples from having a twin because twin is considered very high risk pregnancy, and it has consequences and risk on the fetus or fetuses. So one of the main risks we usually counsel parents the complication of preterm labor, like prematurity. So they give birth before their time. And that will have consequences on the fetuses. So fetuses, they will be admitted to intensive care, and they will have the complication of prematurity. And those complications are very major complications, bleeding in the brain, difficulty in feeding, they have bowel problems, they are subjected to infections, and they are bronchial infections and so on. So usually the outcome of twin pregnancy, the majority they will do fine. There is a small percentages of them, they will have complication with long-term consequences of the fetus. So they might have brain, mental retardation or physical retardation, so in the small percentage of them. And when we compare those percentages of complication to a pregnancy, like what we call singleton, like one fetus, it is much higher. So usually we discourage couples from planning themselves without any medical indication, or they don't have any history of infertility or so on. So we usually discourage those couples from having the idea of having twins. Some of them, they explain it to us like that they have delayed like their family planning for a later stage in their life and so on. So they want or they desire having a twin. Some, they had previous surgery like cesarean section, and they are afraid of having repeated cesarean section, so they wanted to have 2 babies in one pregnancy. Yes.
I'm sorry, continue.
Sure. The other proportion which comes to us as twin pregnancy, they are patients like couples who had delayed conception.
Yeah.
So they went to a specialist in infertility, and they would give them treatment, what we call ovulation induction, so they improve their chances of having a pregnancy, or they have what we call assisted reproductive technique like IVF or so on. Those, they have a higher risk also of having twins because of the treatment. Those are a different category. Once it happens, we can take care of that, and there is certain way of managing those pregnancy. Yes.
So naturally getting pregnant alone has complications, let alone getting twins through IVF.
Both of
also.
them, yeah, both of them, they would have the same risk.
Okay.
But you know, one of the what we call complication of treating those couples with delayed conception with the treatment is having increased the chances of twins.
Mm-hmm.
So those are acceptable. Like they have a medical problems or they have delayed conception, and then with the treatment they got the twin. It's not like we plan it for them and they wouldn't have any like reason for the treatment, that they can conceive spontaneously.
Mm-hmm, mm-hmm.
So it's different 2 groups. So we wouldn't encourage people who doesn't have any history of infertility to go and just go just because of the desire having a twin. And they will undergo the treatment without indication just for the sake of having a twin because of the complication.
Okay.
Well, Dr. Dسمير, what about what are the most dangerous risks or types of pregnancies to the mother and to the child that you encounter?
The majority of patients whom we see in big hospitals, like what we call tertiary care hospitals, or in our clinic, are mothers who have underlying medical problems. Like they come to us, for instance, and they have kidney disease or they have diabetes. So in those clinics, some of the time they come before getting pregnant, and then we can discuss with them like what is the effect of their underlying medical condition like diabetes on the pregnancy, what is the effect of the high blood sugar if it's not controlled before pregnancy on the fetus, because those mothers, they would have increased risk for their fetuses to have other congenital heart disease, other malformation. So we try in when they come to us ahead of time before getting pregnant to identify what specific risk she has. If she has diabetes, then very important to optimize the blood sugar before getting pregnant, because the first trimester, the first 12 weeks, this is when the organs are developed. And if her blood sugar is uncontrolled, then she is at higher risk of having babies with birth defects like congenital heart disease, like heart disease. Mm-hmm. So we can give them advices ahead of time if she has underlying medical disorder. Sometimes they are taking medication like for hypertension, which if she came ahead of time, we can change it to a safer medication, because some of the treatment can have undesirable effect on the fetus, like can induce birth defects.
No.
So,
Doctor, is that like in this region of the world, in Saudi Arabia,
yes,
in particular, we're talking about, is that the biggest problem that we face here? Is it diabetes?
It is
and,
diabetes.
Mothers who have that?
Diabetes, hypertension, and we have a very sick mother sometimes with heart disease.
And so that can then affect the fetus?
The fetus, either directly because of the medical condition or the treatment itself.
Okay.
Well, Dr. Samir Abdullah, I'd like to thank you very much for sharing this time with us on the program and telling us about maternal fetal medicine.
Thank you.
Thank you.
And I hope
thank you very much.
We pass the message of this about this subspecialty and what we can offer for the pregnant mothers, which can optimize the outcome of her pregnancy.
Thank you so much.
Yeah.
And that was our guest, Dr. Samir Abdullah, the consultant of obstetrics and gynecology in maternal fetal medicine, the Canadian Fellowship in maternal fetal medicine, and the director of maternal and fetal care unit in Thaniya Medical Center. We'd like to thank him again. And we're now going to go on a report to introduce our second topic for the evening with Dr. Muhammad Al-Tufail, olive oil and green tea benefits. Stay tuned.